Live here. Should be good to go. Go ahead.
Hello, everyone. Welcome to the university's town hall with Dr. Agwunobi and our other guests. We want to thank you for taking the time to join us. Please remember that you can continue to send your questions through the communications email address. It's communications@uconn.edu, and we'll do our best to answer as many as we can get to today. And also, please remember that this town hall will be recorded, so if you have to leave before it ends, you can still catch the rest of it on recording. And at this point, I'd like to turn it over to you, Dr. Agwunobi.
Thank you, Stephanie, and thank you everyone for joining this town hall. More importantly, I'd like to thank everyone who has welcomed me to this role, to the University of Connecticut in the interim position. There's so many people from the Board of Trustees, the chair, Dan Toscano, Sandy Cloud, Tom Ritter, to the deans, to the senior administrative team, many of whom are here on this call today, to students, to all of you out there. Everyone has just been so welcoming. It's just been almost overwhelming, the kindness. So I just want to thank you all. And I've only been here for a few days, so you might wonder, well, why are we doing a town hall so early on? But I believe there's nothing more important than communication, transparent, frequent, deep communication. That's the way we all stay together. We all hold together through good and bad times and continue on the great trajectory that is the University of Connecticut. But because I've only been a few days on the job, I'm not going to have all the answers myself, and I shouldn't have, even when I've been in the job for a while, because we have a lot of amazing leaders, as you know, in UConn Health, actually not UConn Health, University of Connecticut and UConn Health, of course. We just have a lot of amazing people at the university that can answer all of your questions. And I have some questions that have come to me directly, which I will obviously answer, but there's a lot of people here who can answer questions as well. And they'll sort of introduce themselves as they're jumping in and answering questions. So the other thing I'd like to say is that it will be somewhat discussion format, informal. We'll be talking about, it'll be more than one person might jump in on a question here and there. And I think you'll be sending in new questions that you might have, and hopefully we can make this interactive, at least amongst the participants, but also among those of you who are listening. Before I go into the questions, what I'd like to do is to give a few updates on interesting facts and accomplishments from the different departments and different areas of the university, just in case you haven't followed all of the many things that are happening. So I was talking to the provost, and the provost let me know that we have 90% in-person classes for the upcoming fall, which is wonderful. As you know, because I've heard it many times, that the fall student evaluation of teaching scores was higher than the pre-COVID scores, and we'll have the spring scores shortly. And from student affairs, when we talk about what's going on with the students, 58% of STARS residential students are fully or partially vaccinated. Obviously, we want to get that higher, but we're at least we're over the 50%, and we're heading upwards, so that's good. And actually, over 50% of regional students are fully or partially vaccinated as well. I want to say, I know this is a small piece of it from a financing standpoint, but the impact is huge. I wanted to just mention the Student First Fund and thank everybody who's been involved in that, because they've distributed nearly $200,000 in emergency funds to students that need it. And that's just so critical. So I'd like to thank those involved, but I'd like to thank the whole Student Affairs division. I'd like to thank Ellie Doherty and Michael Gilbert and everybody else that's involved, because the student experience is so important. In Nathan First's area, he's the leader, as you know, of enrollment planning and management. UConn received a record count of nearly 41,000 applications for new undergraduates for the fall, which is amazing. And the fall 2021 entering class is currently on track to be the most diverse class that we have had, and this is for the 4th consecutive year. So we have record numbers of underrepresented minority students. And then the other thing I'll just mention is that in addition to our existing financial program and the Student First Fund that we just talked about, 21.5 million of federal stimulus funds were awarded directly to nearly 15,000 students during the pandemic. So that's wonderful. So thank you to enrollment and planning and management. So I also want to thank Radenka Marek, our VP of Research, for the amazing work that she does. We're on track for another record year in research based on the total awards through March 31st. Last year, we hit a record of 289 million by June 30th of 2020. And this wasn't done with the new initiatives that are coming on board, such as the top hiring or the cluster hiring. This was achieved by investing in existing people, both seed funding from the OVPR office and many other aspects of that. So I want to thank everyone that's involved, obviously the researchers, but also the Office of the VP of Research for all the amazing work that they're doing. In terms of the finances, I remember sitting and listening to presentations similar to the ones we had at UConn Health, but presentations at the university around the $110 million structural deficit that we were facing. And because of the wonderful work of everybody, so most of the people all the employees of the university, as well as the administration, that deficit has been addressed now, assuming the Appropriations Committee budget is adopted, and it allows us to move forward to do what we need to do to continue to demonstrate the amazing value to the state of Connecticut. Frontline workers often don't get their sort of unsung heroes. We talk about police and fire and planning and design and construction, etc. But they have been coming in throughout the COVID pandemic without interruption, and our thanks goes out to them. You know that we hired, I'm going to get the title wrong, but the Chief Diversity Officer, Frank Tuitt, who has hit the ground running. He has provided educational and developmental consultancy to over 1,000 university leaders. He spearheaded over 200 diversity, equity, and inclusion and/or anti-racism related trainings, and hosted a variety of town halls and other ways during this difficult time of us embracing our goal of continuing to promote diversity, equity, and inclusion. Human resources, with huge teams of people, both on the testing side and the vaccination side, have managed to make sure that we've done over 12,000 COVID tests and over 8,000 COVID first dose of COVID vaccines and 5,000 second doses. One thing I would like to obviously mention is that this month is Mental Health Awareness Month, and mental health, student mental health is going to be, as well as employee mental health, is going to be, obviously, continue to be a big part of what we do going forward. And actually, Ellie sent me interesting statistics on this, that when a survey was done, and I believe it's of students, when a survey was done asking students how their emotional health has been, not our students, this is in general, or is it our students, Ellie? Oh, it is, okay. Would say that how their emotional health has been compared now compared to before the COVID-19 outbreak. 43% said it's somewhat worse than before, and 19% said it's far worse than before. And so we're talking about, close to, over 60% who have been impacted. And we all know that when you interact with students or even young adults in your own home. So that's something we have to really make sure that we're continuing to address as we go forward. And Human Resources is rolling out, so from the employee side, a new EAP program and vendor this summer, which hopefully will help a little bit with that. And that will have 24/7 well-being access and over 1,600 specialists across the state for both STARS and the regional campuses. I would like to make sure that I thank the 40 to 50% of our colleagues who worked either full-time or rotationally throughout the pandemic on our different campuses, because sometimes we forget about that a lot of people have just been doing what they've been doing every day, regardless of the pandemic, to keep everything going. So I just want to thank them. Global Affairs, I want to thank Dan Wiener and everything that he does there. There was a very exciting initiative, as you know, many of you may have been involved in this, in partnership with Enrollment Management. Global Affairs set up 2 programs for partners in China for UConn students, for those students who are unable to travel to Connecticut during the pandemic. And that was very, very successful. I want to thank everyone for the innovation and the creativity around that. Another point I'd like to make is the Human Rights Institute is currently in a major capital campaign. So the Gary and Phyllis Gladstein Match and Dodd Human Rights Impact programs have already raised over $5 million. The foundation is always there for us. They're always striving to make sure that, you know, their one client really in terms of donations is us. That's who they serve. And they've had some record-breaking UConn gives with over 5,000, this is the day of giving, with over 5,100 donors and over 700,000 raised for UConn. We're on pace to have another record-breaking fundraising year with 76 million raised so far this year. And we've already exceeded last year's donor count by more than 3,000 donors. Of course, we can't forget athletics. I was out over the weekend with David Benedict and a lot of other people at the rink, the ice rink that was being built. And I just want to thank them. We don't have all the grade data from the spring, but from the fall, in terms of academic success, 70% of the students earned a 3.0 GPA or higher. 18 teams have over a 3.0 average semester and cumulative GPA, etc. So they're doing very well academically. And athletically, the conference championships in the first year of the Big East were field hockey, women's basketball, men's golf, men's track, and baseball. And so I want to thank all the coaches, everybody in the athletics department, Dave Benedict, of course, and everybody who supports them, which is basically everybody. Thank you for that. But most importantly, the student athletes. IT, I'll just say, you know, I found at UConn Health, and I'm sure it's true across the university, that we expect IT to be, you know, information technology personnel to be there, to make everything to work when we come in the mornings, or we do our work, or we're working remotely. And they are often unsung heroes. So I want to make sure that we give them a shout out as well and thank them for all they're doing. They rapidly and dramatically scaled up existing capabilities to meet the demand for VPN, WebEx, Teams, and all the rest of it, amongst many other things that they've been doing during this trying period for all of us to make us feel like everything's moving along seamlessly. Construction, as you know, construction is restarted. So the university planning, design, and construction is moving forward. It's actually completing the 8th year of the 12-year Next Generation Connecticut program. They're doing amazing work. They've completed capital projects that include a reinvestment of approximately $1.2 billion and includes over $220 million of expenditures. So thank you to Laura Cruikshank and all of her people and all the people that are involved in construction and making such beautiful campuses that we have. And then talking about the campuses, you know, Hartford campus, it's a wonderful campus. They do such great work. There's rapid increase in undergraduate enrollment. They've gone from 1,246 in 2017 to 1,659 enrolled in 2020. The majority are first generation students of color, first generation or students of color. And the 85% first year retention rate has increased since 2016. So that's great. It's gone from 82% to 85%. And they've launched some research initiatives, et cetera, such as the Sustainable Global Cities Initiative and others. And by the way, when we talk about them, about being an economic engine for the state, Hartford campus is a very important piece of this. Within 6 months of post-graduation, 82% of students that started at UConn Hartford are employed or have continued their education. And of those students, 93% are employed in Connecticut and 83% are continuing their education in Connecticut. Avery Point campus with Anne-Marie Seifert is also extremely important. A new academic support program introduced undergraduate students as accountability mentors to increase student motivation and to decrease the potential negative impacts of isolation due to online instruction, which of course we talked about in terms of mental health. They've created a white accountability group, which is open to faculty and staff and served as a place to learn about white supremacy and privilege, et cetera, and how we can dismantle systemic racism. And they're just doing good work, they've especially in the area of environmental sustainability. So just want to thank Avery Point campus. Waterbury campus, first generation students make up more than 51% of the undergraduate population, which is the highest percentage of undergraduate first generation students across all regional campuses. They had a very low rate of COVID infection and incidence, so it's thanks to them with their precautions that they've been taking there. I think they only had one positive case this spring semester and only 2 or 3 positive cases in the fall, so good work there. And they're also proud, and we are too, that they are offering the Allied Health degree at Waterbury in 2020 and have 44 majors. Terrence Chang, I wanted to really thank, say congratulations to Terrence. He is obviously now the president of the Connecticut State Colleges and Universities. He's been appointed, and we're just so proud of him. And I'm looking forward to working with him as we go forward. And under his watch, the Stanford campus enrollment has been very strong, flourishing residential population, and a real focus on business technology and digital programs, as well as, of course, experiential learning. And it would be remiss of me not to also congratulate Amy Donahue with her role as the first provost. I think it's the first provost of the Naval Academy, Coast Guard, I think it is. Just want to thank her and say we're also very proud of her. We have an ombuds office that have been partnering. They are now, talk about unsung heroes, they are never sung. Maybe they don't want to be sung, but they do great work. And so Jim Wall and his staff have partnered with the Office of Diversity and Inclusion to present 5 workshops for senior leadership on diversity, inclusion, belonging, and anti-racism. And they're doing much more work. And finally, I just want to thank Frank LaRosa for his great work in the audit department and how that keeps us making sure that we're compliant and doing the work that we need to do. And same thing with Kim Fairney, who's a leader of our compliance area. So those were just a few topics I wanted to cover. And anyone that I missed, please, I apologize. I've just used the excuse that I've only been on the job for 2 or 3 days. But I do want to say that it's everyone. There are always people that we'll forget because it takes, to say it takes a village is an understatement. It takes thousands of people doing all sorts of tasks, from cleaning to maintenance to the health centers to mental health, whatever it might be, to food services. It takes all of those people to make a university run, to give the experience to the students and the education, and also keep our faculty supported. So I just want to thank everybody today. So with that, I'm going to get to the questions. And what I'm going to do is I will read out the questions, and I will we'll sort of just take them, whoever is best equipped to answer them. I'll jump in myself here and there where I have an answer, but a lot of it's going to be by our panelists here. So let's start with masking and CDC guidelines. So the question is that given that the CDC and governor have lifted masking requirements, why aren't those requirements lifted for those working on campus yet? Any insight into masking requirements would be appreciated, including whether there will be differences for fully vaccinated faculty if they are teaching in small classrooms of a few dozen students versus large lecture halls. So I don't know, between HR and Carl, the provost, does anyone want to jump in on that?
Sure, this is Chris DeLello. I'll jump in first. I know that masking and social distancing has been difficult through the pandemic. but the results of that has been an unbelievable health and safety record across the university workplaces. And we want to keep that glide path going through the summer. We are evaluating the CDC and the governor's guidelines. And but for the summer, we are continuing to require masks. And as soon as we can, we will tell you about masking in the fall. Carl?
Anything?
Thank you.
Adam?
Yeah, and the other thing that I would say is, we'll obviously follow where the university is in terms of class spaces. We don't plan to have different requirements in different sorts of classes, but let's say you're in a performance-based class or something where it is unique. That's where it's important to talk to your department head, your dean. We can always try to work out arrangements if there's something particular that would work best. And the other thing to keep in mind is you always can continue to wear your mask if you would feel safer that way, even if that's lifted. So generally we want to have some consistency, but always reach out to your department head where you have other thoughts.
Yeah, so it'll be fluid, I think, yeah. For those of us with, this is similar, for those of us with active laboratory-based research, getting back to the lab is essential. When will we hear whether the 6-foot distance requirement between individuals is lifted? I don't know if HR is going to answer that, or does Radenka want to jump in with any thoughts?
Sure, I can tell you the analysis of both mask wearing, social distancing, and vaccination is currently at the forefront of discussions with administration. And although we don't have answers yet,
I think Chris froze up. Can everyone else hear me? Yeah. I would just add to that, one thing even though we don't have an exact answer to some of these questions today, I want everyone to be reassured that even in my first week here, the senior team has immersed me in these questions, and we're obviously working through what the opening in the fall will look like. It's for me, opening is the opening at near full capacity safely for everybody is the top priority. So this is certainly something that we're talking about and looking at, and we will get back to everyone as soon as we can. Now, and obviously things are changing around us, so that's also a factor. But we're definitely looking at this and taking it very seriously. In terms of vaccines, so will UConn require students and/or employees to get the vaccine as a condition of participating in person on campus in dorms, classes, and other events? And if so, what will happen if a person has concerns about the vaccine and doesn't comply? And would surveillance testing be expanded to include employees? So I'm going to turn this over, but before I do, I'll turn it over to Ellie. But before I do, I just want to say this is a question that I'm actually discussing with different stakeholders right now. In terms of, we started discussing it a couple of days ago. I'm reaching out to different stakeholders, both internal and external, to discuss about this, because there are obviously ramifications each way. But certainly we are moving forward to understand this issue much better and make a decision on it soon. So what I'll do is maybe I'll turn over to Ellie and see if you have any additional thoughts on this.
Yes, thank you, Andy. And hello to everyone I can't see, but it's just wonderful to be connected with you and having conversations that are filled with possibility and change for the fall and emerging from COVID. And that's really where I want to start when we talk about vaccination, that the best way to emerge from COVID is to be vaccinated. And it is only with that, tool in our toolkit that we're able to start really critically evaluating whether, the use of masks, occupancy in our residence halls, making those apartments available that I know the students want, that I've been holding for isolation, how we interact with one another. All of that is significantly easier when we're a vaccinated community. And this is particularly true for our student population. So right now, the vaccine is not required for students at UConn, but I want to say personally, I'm certainly encouraging of those who get vaccinated. It allows us to be that much closer to the experience that we miss that we had prior to COVID. So if you wish to be vaccinated, STORS is currently vaccinating STORS students, and you can sign up for an appointment through the portal. We also have connections to DPH and all of the sites in Connecticut where students can be vaccinated. You need to report your vaccination to us, and I'm really thrilled that we're off to a good start with over 50% of all campuses, and as Dr. Agwunobi mentioned, 58% of our residential students beginning the vaccination process. But for us to make decisions about releasing beds, bringing us closer together as a community, that good start is a good start, but it's not victory yet for us. So for us to start releasing those beds that I know the students are really interested in, we really need to see more like 70% in a residential community. And we're going to be tracking that closely. I'm talking with colleagues later in the week to make sure that's publicly available to students, for all of you to see how your collective efforts are keeping us healthy and safe as a community. When you come to campus in the fall, and this is particularly true for our international students or folks who may have trouble obtaining a vaccine right now, we'll be ready with vaccines and we'll be able to vaccinate you upon arrival. I recommend that you do it before, because any student who is not fully vaccinated when they come to STORS or any of our residential programs in the fall will need to observe a modified quarantine. So we'll need to make sure we build that bubble around you because the protection of the vaccine is not in place. If you're vaccinated, you're off the hook. No surveillance testing, no quarantine, none of that. But if you're not vaccinated, we want to work a little harder to keep you safe. So it's going to be very similar to how we approach student health over the course of last year. So non-vaccinated students will have a modified quarantine. They'll have to participate in surveillance testing, and we'll want to keep close tabs on your health and the risk of exposure to the virus. So I just want to close and say you have always shown me how much you care for others. You made significant sacrifice last year, and all of our effort is focused on bringing us back together as a community. And that vaccine is really our key catalyst in doing that. So I want to encourage you to make the right decision for you, to be informed. Not every individual can be vaccinated, but if you can, it's important for us that you do that. If you're an international student, we're following CDC guidance. So WHO authorized vaccines are wonderful, but we really want you to be safe. So if you have access to vaccine, let's be safe. And if we need to provide you more medical care when you come to campus in the fall, of course, we will do that for you as well. And I'm going to keep talking to you. So there'll be monthly emails from me updating you on how we're doing. I know you got an email from me last week. There'll be another one in June. And July will be a really important time for us to really put a tack in the plan and share it with all of you.
Thank you, Ellie. Thanks for that. So great work to you, Ellie, and you know, I can tell how much you care about the students, so that's wonderful. And you know, I think again on the question of mandatory vaccines, it's something that we're studying right now. We're analyzing. We haven't made a decision on that yet, but I can assure you we're looking at it closely, and we'll be making a decision soon, obviously in time for the opening of the semester. So another question was, what would you say to those of us, and this is a faculty related question, what would you say to those of us who have concerns about exposure to unvaccinated students and whether their offices have adequate ventilation and safety measures? I don't know, Carl, do you want to jump in on that?
Yeah, no, I'd be happy to. And I think my answer is a bit of what I've said previously. So you are always able to continue to wear a mask. There are ways in which you can set up your class spaces. You can reach out to your department head. I know that facilities is always happy to try to help with that. But the important thing to keep in mind is we were very safe in the classroom in the previous year. As far as I know, there were no documented cases of any instructors getting COVID from being in the classroom. And so we want to just continue to do what we can to be safe. But it is really important for us to get back to that in-person environment. And I believe we have what we need to be able to do that.
Okay, thank you. Does anyone else want to jump in and say a few comments on that? Okay, all right. Well, let's go on to
Andy. I just echo that. The classroom was consistently one of our safest spaces on campus. There wasn't student spread, there wasn't student faculty spread. So great practice there and observing precautions to make sure we're healthy.
Okay, awesome. Thank you. So this is another faculty question. Will a potential, as faculty and employees, other employees, will a potential hybrid/remote work plan be developed by the fall 2021 semester? And what options will regular staff members have? This is obviously a key question. A lot of I think not just at the University of Connecticut, but across the country. So it's an important question. I don't know, is Chris DeLillo back on? Do you want to say a few words on this?
Yes, I am. Thank you. And hopefully I won't time out here during my response. So yes, the Future of Work did some phenomenal work. There were 46 union and non-union colleagues across the campus that came together, and they separated into 5 working groups. The Working Needs and Arrangement Group, the Reentry Rollout, Public Health in the Workplace, Infrastructure and Facilities, and Employee Development and Support. And the Working Needs and Arrangement Committee, as well as all the committees, just did a wonderful job and delivered on their reports as of last Friday. The committee is meeting again this week as a large group and convening a discussion. But I will tell you, loud and clear, there is both an expectation and a desire to have hybrid and teleworking arrangements. And the working arrangement working group did a phenomenal job of building a rubric that will allow managers and their departments to do an assessment of planning needs, in-person needs, as well as teleworking arrangements. We expect to have that out early to mid-June, so the campus community can start to make their individual assessments. And using the rubric, our hope is that there'll be consistent approaches that can be developed across the university system.
Okay. Any other thoughts from anyone else on the team? Okay. All right. So let's go to the next question. Thank you for that. What approach will you take, and this is obviously to me, to negotiating the new contracts with employee bargaining units? And do you support raises, given the number of times in which salaries have been frozen over the last decade? Well, obviously, you know, bargaining is a confidential process. There's a negotiating team that works to bargain the contracts with the union leadership and others, and recommendations are made, and we'll look at what those recommendations are and make decisions based on that. But why don't I turn it over to Chris DeLillo, who's the head of HR and obviously much more involved in this and knowledgeable about the current negotiations.
Certainly. We're negotiating with our faculty and staff unions currently, and the very premise of negotiations is that both parties work in good faith to arrive at a contract that works for everyone. We continue to, we are at the bargaining table, and we are continuing to work through the proposals and with a number of analysis and good work that's being done.
Okay. So I think the bottom line is, you know, we hear you, but you know, the negotiations are obviously something that's ongoing, fluid, and obviously private. So we're not able to I think say much more at this point, except for what Chris has said. But thank you for sending that question in, and it's duly noted. My staff and I lost a number of vacation days last year due to business needs and limited staff working on campus. We simply couldn't take off all of our vacation days and time allotted off, and at the same time fully support the needs of the university. Are there any plans to increase the amount of vacation days that employees can carry over? So this is back to you again, Chris.
Certainly. This is a great question. Earlier on this year, the university administration reached out to our professional union, UCP, and we have been working with them on a stipulated agreement to allow for carryover of 2020 vacation as a pandemic exception. They have been great colleagues in working with us, sent back questions. We've made modifications, and we are now working through that, and hopefully we'll have finalization this week. As well, we have provided a pandemic exception for our non-union staff as well.
Thank you. So from a student perspective, how do you plan to address budget cuts that have impacted graduate students and workers across the university? How do you plan to protect workers from future austerity cuts? So at this point in time, I know a budget is being prepared, and that's something that we as a senior team and the board of trustees and others will discuss the budget, obviously, as usual, and that will be presented in the usual manner. So at this point, I'm not aware of the details of that. But I do, again, this is another one of those questions where I would just say I've noted the concern. So I'm noting the concern that you're expressing, and we'll definitely kind of bear that in mind as we're looking at what the budgeting is going forward. But I'll pause here and see if Ellie or Carl or anyone wants to jump in and say a few words about this.
I can just share that. So there has been cuts over the last several years, and at least specific to the academic setting, one of the concerns that deans have shared with me is if how long will these cuts go on for? And I know that in other settings we've talked about the reasons for these, some of the structural deficit, but I think what is important is what we've tried to do on the academic side with deans is identify over a 2 to 3 year period what we are able to do in terms of some modest additional cuts, so that we're hopefully not going to have to keep doing this over and over in time. Now, what that does mean is that the deans do need to find places to make some of those additional cuts. We certainly want to limit the impact on graduate students. And just to be clear, this doesn't mean that we are reducing salaries or taking other things away from graduate students, but it does mean in some cases we may be having fewer students within a particular program. These are, in most cases, not likely to be anything long-term, and in some other cases they're part of trying to figure out what's the right number of students within a program. So we will have some transition over these years. I want to acknowledge any cuts are hard, but we are hoping to try to figure out how to do this in a way where we have the deans and department heads making those decisions. You don't have the provost reaching through them and doing it, and do the best we can to try to ensure that over a period of years we're hopefully able to go forward without having to do additional cuts.
And the other thing I would just add to that is obviously the mission of the university always trumps everything else. And so we as leaders have to, whenever we're thinking about the budget going forward, we have to also think about long-term, not just short-term, but long-term. How do we continue on the trajectory we're on? How do we provide that education that we have committed to provide, that quality of life that we committed to provide, the support of the faculty that we need to continue to support, otherwise we won't have the quality of education that we're talking about, or the research that we're talking about. So I do think it's important for us to continue to not be short-sighted or only looking short-term, but to continue to look long-term when we're budgeting. So you can rest assured that will continue to be a guiding principle as we move forward. Ellie, it looked like you wanted to say something.
Yeah, and it's in that spirit, Andy, that these have been difficult times and the future will continue to be difficult. And yet we have preserved some of our most critical resources for students. And I'm thankful to the university for that. So we've had to preserve and enhance medical care for students. And there's no way we're going to compromise on that obligation. And we have absolutely heard the call to provide a mental health network of care and support for students that is more, comprehensive than simply an appointment. And that is something too that I'm really grateful to the leadership and to the board for finding ways to find the means to make that work happen. So I would say these are difficult times. We are all accepting cuts, but we are not compromising on key resources for students.
Right. Of course. That's very well said. The other thing I want to just pause and say a big thank you to graduate students, because we talk a lot about undergraduate students, and we sometimes, I wouldn't say we forget, but sometimes we don't talk as much about graduate students and the amazing work that they do and how proud we are of them, and how important they are to this university. So certainly that's taken into account whenever we're thinking about initiatives or decisions going forward. And I think I'll come back to it, but I'll jump to a question that was for me that was, because it's kind of a good segue, which was, what have you learned from your time leading UConn Health that you hope to carry over to STARS and the regionals? And I think I've learned probably 4 things. One is that the University of Connecticut, whether it's UConn Health, whether it's the regionals, whether it's STARS, is a phenomenal organization that impacts generations of people, and impacts the whole identity of the state. And so the importance of this organization cannot be overstated. And so that's one thing that I've learned. The other is the importance of involving employees, and particularly, employees and faculty, particularly faculty, in decision making. And luckily, universities and to a certain extent, health centers and health services have realized that is extremely important. That it's important for faculty to be involved in decision making. The other thing that I've learned a lot about is the importance of communication. And people have talked about communication that I used to do and still do at UConn Health. And I hope to bring that style as well to the whole of the university. Now, not to say that previous leaders have not been great communicators. They have been. But I just want to build on that and generally bring some of the tools that I've learned to be able to enhance that. And then finally, the segue I was talking about was in finances. One thing I've learned in my career is that, it's important to never forget what you actually provide, what your mission is, what your value is to the state, to students, to faculty, etc., to the families of students. It's important not to forget that, and even in tough financial times, always investing in that. And that's what we've done at UConn Health, and that's what I've done in previous situations. And I know that this is something that I think the senior team would agree with, and we'll continue as we go forward. Coming back to some of the other questions, when will events such as orientation for first-year students start returning to in-person offerings? That would be for Ellie.
I'll use the student phrase. I'll popcorn it to Nathan.
Okay, Nathan,
orientation.
over to you.
Happy to jump in on that one. And excuse me, I'm having a scratchy throat. So actually, I'm going to popcorn it back to Ellie, who I think I knows the answer only because my throat is scratchy.
This is teamwork. So Nathan, I'm going to get your face alongside mine, but so orientation for this summer is remote. And then we will be returning to orientation in person in the future, in future semesters. So this is our last time with an remote orientation. We know it's not optimal, and we'll be returning to usual orientation practices in coming semesters, but not this summer. How'd I do, Nathan? I don't know how to virtually slap you on the back so you can breathe. So hopefully you're doing better.
Yeah, we need to keep an eye on him, make sure he's okay. But thank you for that. Beyond managing, will more effort be made to lobby state legislators to give more money to UConn to offset high labor costs? Well, I'll answer that in two parts, and then I'll turn it over maybe to Scott Jordan. One is that yes, we never stop talking to. I don't want to say I don't like the word lobbying, but talking to the state legislators, who in general are very, very supportive of University of Connecticut. The state government, state legislators have always been there for us. And so continuing to talk with them, continuing to involve them in what we're doing so that they can support us as they want to is something that we will always do and we continue to do. The part about offsetting high labor costs, I mean, I would say it's more about a part of it is unfunded legacy costs. And then, of course, just making sure that we have the funds to continue to have, what I think is one of the best universities in the country, one of the best public universities in the country. So I'll pause there and see if Scott Jordan, who's been with me as we talk to legislators, has anything he'd like to add to that.
No, Andy, I'd only amplify what you said, which is that we are always telling UConn's story in the State House and with folks in the legislature. And we've consistently had their support. And oftentimes when the UConn's financial support from the state really just mirrors the ability of the state to support us. And we are optimistic that this fiscal year, the state, which is faring the pandemic in relative health, will be supportive in the budget, which we expect to be wrapped up by June 30th. So the answer is yes. Of course, we will always be working with the legislature.
Okay.
And it is helpful. And we have had help from the whole UConn community in that it's not just Andy and me talking to folks, but it is the whole of UConn Nation. Telling their stories.
Actually, I'll just build on that and say a big thank you to the government relations team. So Gail Garber and Joanne Lombardo and Maureen Magnan for UConn Health. They're just phenomenal. They're out there all day long, every day. And when I'm in meetings with legislators, those legislators, they respect them and they like them and they listen to them. And that makes the job a lot easier. So I just want to thank them for that. Beyond managing financial inconsistency and concerns, what do you anticipate being the most challenging aspect of the role? I think the most challenging aspect is getting to the opening in the fall in the right way, and making sure that we navigate the pandemic as we do that we navigate concerns around in-person versus telecommuting, that we navigate the concerns around vaccinations and safety and social distancing and masking and everything that's changing weekly and sometimes daily as we approach that date. So that is going to be a challenge. I feel very confident that we will navigate that. I think the university has navigated the pandemic in a very admirable way, and we will manage this part of it as well. But it's obviously a challenge and something that we are extremely focused on. Do you see the continuance of life transformative education as a major initiative? And how do you see experiential learning and career development fitting into the conversation? So I'm not going to try to be an expert on this, but I do want to say yes, we do see this as continuing to be a major initiative. I think that independent research, internships, experiential learning, everything that goes into transformative education is critical, and so that will continue. But I'm going to turn it over to Carl, who's our sort of chief academic officer as provost, and see what his thoughts are.
Yeah, I mean, the answer is really simple. I mean, if you think about the things we want to do academically, life transformative education is something that in many ways we were already doing as a university. This has just allowed us to better understand what are ways to enhance it, to better understand the way it's impacting students, and to have a sense of what are the best ways to support it, both in terms of what we say and also budget. And so when we think about the strategic plan and the way that that continues, pieces of it like life transformative education are absolutely crucial. And the work that the life transformative education working group has done will all be valuable, and their work will continue.
Thank you. Now I'm gonna go quickly through the remaining one because we have 10 minutes left. And some of them can be answered quite quickly. So one is in an interview, Dr. Agwunobi, you said that UConn also, of course, plays a vital role in fueling Connecticut's economy and its workforce. And so the question is, will fostering innovation and entrepreneurship be a priority for your administration? And the answer is yes. So it will be a big priority, working with Radenka Merrick, working with the deans, the faculty, everybody else on this call. That is going to be a big piece of it because it's important to the state of Connecticut, and it's an important part of our value that we can bring both to ourselves, but also to the state. So that will be important. The interview also mentioned that updating the academic strategic plan will continue unabated. Can you elaborate on that? How do you see the requirements regarding students' exposure to laboratory-based natural sciences? Well, the specific question at the end, I'll leave that maybe to Carl to address, but we're actively, actually, even as of this morning, I met with Carl, who's obviously leading the strategic planning, along with many, many people. Thousands of people have been involved. So I'm involved in that. I'm immersing myself in that so that we can continue that planning and make sure that it's everything that it should be for such a great university. So Carl, any thoughts on the last part of that?
Yeah, just, in the same way we talked about life transformative education, we feel the same way about the importance of the research mission at the university, and where those intersect is in research experiences for students. And now, of course, we tend to think of those often in terms of STEM, and that is really crucial. But if we are really going to expand those experiences to where all students who want one, then we have to make sure that we're finding ways that that's happening in history and philosophy and in our professional schools. And so I do want to address STEM and say, yes, that's absolutely important, but we believe for life transformative education and research experiences, it has to be across all of the great resources we have at the university.
Yeah. Well, what's a nice segue, actually, because one of the questions was, as we continue to hear about the importance of STEM, what role should education in the liberal arts and humanities play at UConn and society? And I just want to say personally that I think it's critical. I remember, I was looking into this, and I remember a quote by Steve Jobs where he said, "It's in Apple's DNA that technology alone is not enough. It's technology married with liberal arts, married with humanities, that yields the results that make our hearts sing." And there's so many, as you know, there's so many, different bodies of evidence that demonstrate that one without the other is just not enough. It's not a complete education. So I'm going to turn it over to Carl and see if you have a few comments on that.
I just agree with it. And this hopefully you have seen enough as a community over the past year in why that is true and how that matters. And that's in support for, I was a liberal arts and sciences dean. So this has always been really crucial to me. And again, it gets back to the idea as we think about ways in which we're truly interdisciplinary. I just think of examples in how the arts and engineering are working together, ways in which human rights is connecting with the arts, and then in terms of things that are happening within the Humanities Institute and the way that they're expanding, the way that we think about some of those traditional boundaries. We are a comprehensive university, and there will always be an important role for the arts and liberal arts here.
Thank you. Do you plan to continue the important work began by President Katsoulias to address diversity, inclusion, and equity and concerns about racism? What will that effort look like? I think in the interest of time, I'll just say to you that the answer is yes. and that in some ways, even though we have a new chief diversity officer, the main chief diversity officer has to be the president, and that I see that as my responsibility and my role. So in this interim president role, I'm going to be very focused on that, working with Frank Tuitt as well. Is this an opportunity to bring UConn Health and the rest of the university closer together? I would just say yes, it is an opportunity. There isn't any specific initiatives around that, but you know, having the interim president be also the CEO of UConn Health is sort of the definition of one UConn, and so we certainly will be able to look at that and see where there are opportunities to enhance what we're doing as an organization. How can transparency be increased about leadership changes and other topics of university-wide interest? I think the university has always tried to be transparent where it's appropriate, but I can't speak to, I won't speak to sort of the past, I only speak to the present and the future, and say that one of the reasons I'm doing this town hall now so early on, and there will be other communication tools and methods that I will try to work with the senior team to see if we can bring forward. There will be as much transparency, I think, as there can be. What steps is the university taking to make a college education accessible to college-age children of state residents of limited means? So maybe that's a Nathan question.
It is, and I'm going to see if my voice can actually hang with us here a little bit. That's something that we focus on always, regardless of the environment that we're in. We know right now that the pandemic is impacting a lot of families and their finances. And as Dr. Andy spoke earlier, we were able to assist a lot of students this year, both through the Students First Fund, but also through emergency financial aid grants and also federal monies as we supported those students. But we're always keeping our eye on our neediest students and their unmet financial need, tracking that over time, watching average indebtedness, and just ensuring that this UConn degree and the experience that we deliver here is the most affordable opportunity for our students that need that assistance as they go through their undergraduate education. So it's of the utmost importance and top of mind all the time for us.
Thank you. Does anyone know the answer to the specific question, when will it be possible for fully vaccinated employees to use the rec center again? Sure. Ellie?
Sorry, my computer was wonking out. So our plan in fall is to have it fully open to students, faculty, and staff members. We know you miss it, and as our vaccination rates rise, so too does our confidence in hitting full occupancy again in the rec center.
All right.
And I'd like to thank Ellie and her team. HR has been meeting with the rec center staff to work on a plan to have employees come back by August.
Awesome. Yeah, thank you very much. Parking. So those who have been working on campus have had to resume paying for parking, while those working remotely have been able to save by not paying this anymore. Could parking be reevaluated for lower costs to staff and faculty during these times? Scott, do you have a quick answer? 1 minute?
Yeah, sure. Of course, you can buy your regular full-time pass. You can also pay by the day. The university has a pay by phone app that you can use to pay for parking each day. And over the course of this summer, we are evaluating within the system that we use, the software, the ability to provide part week passes, where on a fixed schedule, maybe you would be able to buy, say, a Monday, Wednesday, Friday pass. That's still to come. We're working on it, but we'll let you know as soon as we finish our work.
All right, thanks so much, Scott. So I think that's the end of our submitted questions. But Stephanie, is there one question or so we can take just before we close?
Yes. A question has come in. If booster shots become a necessity, will UConn have booster shots available to the UConn community?
I think the answer is yes. We will definitely make that available, but I'm not sure we know exactly what the supply chain looks like right now. Does anyone want to comment on that?
Sure, I'll take a stab at it. Throughout the pandemic, a small team of colleagues across campus met with UConn Health on a regular basis as we supported the testing and vaccination process at Hawley. And even though Hawley right now is intended to end vaccinations on June 30th. We continue to have discussions about what the fall would look like and if there are alternate plans to continue to allow vaccines and potentially boosters. Every time we meet, we have those conversations. So we're planning ahead and thinking through what it will take to lift those up.
Right.
This might also be a good time for Dr. Bannock and Dr. Era to chime in
Yes.
on
Nice.
accessibility to boosters and even thoughts on naturally acquired immunity and how that interrelates with vaccination.
So
If I
that's
may.
a great idea. Go ahead.
Sure. So thanks, Ellie and Dr. Andy. So, I'm one of the infectious disease physicians here at UConn Health, and my take on boosters is at this point we really don't know. We know that the immunity from vaccination lasts for at least 6 months and likely significantly longer, but only time will tell. And the data will inform us as to whether or not boosters are going to be needed. But I know here at UConn Health, and I'm sure the university at large will be supportive of boosters.
Yes.
If that is part of the future.
Yes. Dr. Era, do you have anything you'd like to jump in
No,
on?
and then just, yeah, to weigh in on natural immunity, again, I think we just follow the guidance along with our CDC and DPH colleagues is that we recommend vaccination regardless of natural immunity.
Okay, thank you.
If I could say one more thing, since we're on the topic of self-care, I'd like to remind our community that participates in the state's health and welfare plans that enrollment ends on Friday. And please continue to think about your well-being. And you can access hr.uconn.edu to find a whole range of well-being resources available to faculty and staff. Thank you.
So thank you. So I want to thank everyone. If there are other questions that have been submitted, we can pick them up perhaps for the next communication, whether that's in writing or otherwise. But I just want to thank all of you who are listening in, whether it's students or employees, or faculty, everyone that's listening in. Just thank you for what you've done in your own way to make the University of Connecticut so great. And have a wonderful rest of your day. Thank you. And thank you to